I'm sharing my screen right now. Okay, it's going to go live in a minute. Hi, everybody. This is Jackie here. We're just getting ready to go live with Dr. Natalie Montfort. We are going to be discussing autism acceptance, talking with your child about their diagnosis. I'm going to go ahead and stop sharing my screen now. All right. Hi there, everybody. I'm Jackie, and this is, sorry, we're actually recording this presentation. I wanted to make sure I did that too, get all the steps done. So I'm with Dr. Natalie Montfort this evening, and she's going to be talking with us about how to talk with your child about their diagnosis. We thought this was a really great topic for Autism Acceptance Month, which starts today. And, it really, really is important to, your family's well-being and your child's well-being. And so we're really excited. She's got some really good words of wisdom. And, we've liked what she's had to say about this topic. And we know you're going to like that as well. So Dr. Moffer, I'm going to turn this over to you. And I'm going to turn off my camera now. And if you would like to, you can share your screen and go ahead and begin.
Great. Well, good evening, everybody. And thank you for having me tonight. This is a neat opportunity, and I'm happy to be here and talk to you all about the information that I've gathered over the years about talking to children and others about autism spectrum disorder and kind of who needs to know what and when. So like you mentioned, I'm a clinical psychologist, and I've been in practice since 2015. and working in this field since 2002. So I've had the privilege of meeting a lot of adults, adolescents, and children on the autism spectrum, and all of working with those families and those individuals is a big part of where I've been able to pull together this information to share with you today. It was one of the most commonly asked questions that I received in doing kind of counseling services with families or parent coaching or working with individuals. Additionally, working with adults on the autism spectrum who want to have a greater understanding of what autism is and isn't. So we'll be talking a little bit about that today. All right, I am also a parent of a child on the autism spectrum. So the conversations that we're talking about tonight, I've had them myself, so we can troubleshoot and talk together and talk about what's worked and hasn't worked. If you have questions, please go ahead and submit those, and we'll do a question and answer at the end. Now, today, we won't be able to discuss everyone's exact needs in detail. So I just want to tell you a little bit about what to expect. One, we want to be respectful of the ideas and opinions of others. So different people listening here tonight, commenting afterwards, may have different ideas and opinions, and that's okay. I'm not here to tell anybody what they should do. You are the experts on yourselves, on your families, and on your own children. So by no means do I purport to know the end-all be-all for everyone on the spectrum. But like I said, these are some ideas that have been gathered through my experience, through my work with different individuals and different families that I hope is helpful on some level to each of you. So we're also going to be inclusive of all ability levels. And what I mean by that is that we have individuals here today who are self-advocates on the autism spectrum. We also have family members here who are representing individuals with all levels of support needs. And that's okay. We are going to talk about what might work for different age groups, for different developmental levels, and for different verbal levels. So there may be some things that don't apply to you or your family member. And we ask that you just be patient because it may apply to someone else's family member or to someone else who's here today. Let's see, we also have some of the things that we'll discuss, or the strategies, are going to require a certain level of developmental maturity or cognitive ability. And we're not judging anyone based on ability or disability in any area. If the information isn't particularly fitting to you or your loved one, just keep an open mind is all I ask, because it might be helpful for you in working with family members or community members, future employers, educators, or strangers. And then we're going to be a source of uplifting ideas. So this kind of goes back to, if you don't have anything nice to say, no, any uplifting ideas are welcome. So all of what I am going to be sharing and have learned have come from families and people like you, as well as from the experience. So, please refrain from criticizing others for their questions or ideas or their opinions. And just remember and respect that the intersection of autism and every person's life is going to be different for every person here. So let's go ahead and continue. And the question here is, do we tell or not tell? That's the question. So what we're going to talk tonight about is the idea of talking to your own child or teen about their own diagnosis of autism. And there are lots of different directions we could take this, and there's so many more ways we could go, but that's what we have time for tonight. So we got to focus a little bit. And, a lot of families ask me, should we tell? And why should we tell? Or we have concerns about telling. So some of the reasons that I hear from families or parents of saying they're not interested in talking to their child about autism, they tend to revolve around fear. So fear of hurting the child's self-esteem, fear of creating this learned helplessness, or different fears like making autism real or permanent. So there could be lots of different reasons, fear that the child will tell other people, oh, they might say something at school, they might tell their friends, they might tell, the family members that we didn't want to know. So there's a lot of factors that go into making this decision for each family. And that's tonight what I am not here to do for you, is to make the decision, right? Because I don't know all of the factors and the intersecting pieces in your family's life. But for the sake of our talk tonight, we'll go ahead and talk about why we would want to talk about autism. All right. So we would want to talk about autism to help increase self-awareness in our child or loved one, increase their empowerment, and self-advocacy. Think for a minute about something, you're not good at. Now, have you assigned a reason for it? So I'll give you an example. I happen to be a pretty poor speller. This is real life. So is there a reason for it? Some people might think, well, I'm a poor speller because I'm not smart, or I'm a poor speller because my first grade teacher didn't teach me spelling well, or I'm a poor speller because I have dyslexia. So are those reasons internal or external that we've assigned to something that's a little bit more challenging for us? Now, if we don't have an external reason for the challenge, so meaning if I don't have something to explain why I have difficulty with spelling, there's a high risk that it could become internal. I might start to think that, I am not as good at school as other kids, or I'm not as smart as other kids. And so what we want for our loved ones is that they don't assign internal reasons for any difficulties that they have. And this is true of all children and all difficulties. I'm a huge fan of words like, we're working on helping the teachers know how to best teach you when a child is struggling at school. Okay, so we don't want them to blame the school, but we also don't want them to blame themselves when they're getting poor grades or things are difficult. Maybe they have a learning disability that's not diagnosed. Okay, so for the sake of this talk, we are going to look at what the literature says, right? And when I first started doing this talk with families and individuals, there was really little written on the topic. There was a lot more about physical disabilities, but we can't hide those, right? So that was a lot easier. We needed to look at things that were, a hidden disability or a hidden difference for a better comparison. So, for example, adoption. It used to be that we told, it was purported by some to not tell individuals they were adopted. We learned that this was ultimately traumatic or damaging. People eventually found out later in life for various reasons. And what we've come to find, since more and more work has been done in the area of autism, is that the same appears to hold true. If we withhold this information, it could be potentially damaging in some places, or to some people. So most professionals agree that we talk to children in a language that they understand. All right, so we're talking about a different conversation for every different person. All right, let's go down here. Okay, so we've covered most professionals agree that telling children empowers them and helps them become their own advocate. So I had a 9-year-old that I was working with, and his mother showed him a video about autism. And after he watched that video, he said, that makes so much sense. And this was a young man that was just starting to have some internalizing for what he was recognizing as his own areas of difficulty. So he was recognizing he had trouble at school. All right. And then he started to say things like, I'm a bad kid, or nobody likes me. And we talked about, it may be time to give him a different reason why it's hard for him to stay seated all day, or why it's hard for him to focus on his schoolwork. I was working with a young adult on the autism spectrum who told me that when he learned he had autism, he felt normal for the first time. And the main reason for that was that he knew he wasn't the only one. He always thought that he must be the only one who was different. Until he had a reason, a conceptualization, something to learn about, something to, to grow through. All right. So what we've come to find is, just in working with families since 2002, children will often find out. Okay. And what I mean by that is, even if we don't tell them, when we have multiple doctor's appointments, or they attend speech therapy, or they go to a social skills class at school, there are ways that autism might come up related to your child that aren't within your control. They may find a diagnosis code on a piece of insurance paperwork, a chart note, an evaluation report. They may hear a conversation. So I always talk with families about, we have this choice. We can tell them intentionally or unintentionally. And I really like the word intentionally, because I mean by that with intent, with intentionality. We can direct how they handle this information, what they make of this information. And I don't know if any of you have watched the sitcom called Parenthood that used to be on the air. I can't show you the clips here on our talk. I have purchased these episodes for myself because I do think that they have an educational value. And it's 2 different episodes. You can probably find them online, or perhaps stream the series. But essentially, this young boy who's in the picture, he has autism, and he has low support needs. And the family hasn't told him yet. They're all just kind of making sense of the information as they go. And they didn't intend to not tell him, but they didn't intend to tell him. And he overhears a discussion between the dad and the uncle kind of arguing. And eventually the father says, don't you get it? Your nephew has Asperger's, which was what the show says. And the little boy is standing on the stairs kind of looking at him, and he says, what's Asperger's? So his finding out was definitely not how the family had planned. I've also worked with a number of families and a number of individuals who were first told about their differences or uniquenesses, and these could be positive or negative, by their peers. So, families thinking about, do we tell, do we not tell? One of the things I suggest they consider is, do you want to be the one to tell them, or do you want to let their peers? And I do a lot of talking about sex education as well. And this is another thing that comes up there too. Do you want to educate your children about sexuality and puberty and hygiene, or do you want the internet or their friends to do it? It's best coming from the parents. And I think this is another situation that's similar. We as caregivers, as family members, can do this in a strengths-based way that maintains our family members' dignity, that promotes self-esteem, and that that isn't damaging, bullying, teasing, or harmful to them, right? So I had this incident, and I know we think like, well, kids won't really talk about it, but they do, and they do even in therapy settings, in ABA clinics, schools, wherever that may be. So I overheard personally on a playground track a child saying, "I know what your Asperger is. It's being oddly obsessed with weird bugs." Well, of course, that girl then needed to know what this boy was talking about and why did he think it applied to her. So, her family got to have that talk pretty quickly and unexpectedly because of some information provided by a classmate. All right. So for the sake of our talk, we're going to assume that we're ready to talk. Now, remember, I am not suggesting this is the right choice necessarily for your young person, for your family, or for you. But to get us through the next bit of content, we're going to go ahead and assume that talking is what we've decided to do. So now we need to know, well, what exactly do we say? And my favorite question is, what if they don't get it? All right. So I like to show a clip that we're not, again, going to show because of copyright violation. And it's from the Parenthood series again. So it's how Max's parents follow up after he's overheard the dad say that he, has Asperger's or autism. And I love to play this clip or refer people to go watch this clip because, talking about something that seems sensitive tends to provoke a little anxiety or a little what if in all of us. And, what if I don't do it right? What if I hurt their feelings? What if I get it wrong? What if I scar them for life? And I just want to assure you that once you watch this clip, you'll go, oh, well, gosh, I'd do better than that. And it's true. So you can even see from this picture here, look at their emotions. The mom over there is crying. And dad's kind of not sure what to do. Does he comfort her? Does he keep talking? So they just sort of miss the boat on this one. They're not able to speak with composure. They're breaking the news to poor Max, who's, sitting down as if this is some, life-altering medical ailment. They use the word right off the bat, disability. The parents are talking over each other. They also don't seem to be in agreement with what they're going to tell him. They start talking about his difficulties and his struggles. And Max is kind of like, well, I didn't really, this is news to me. So they've set up the situation to just not go well. And then Max asks, do my sisters have it? Does anybody else in the house, in the family have it? And his parents say no. And then mom really starts crying. So now he feels alone. He's worried about his future health. They've told him a whole bunch of negatives, and he's the only one, right? So we pretty much hit like all of the don't do this situations. All right, well, don't worry though, because they will get it right, and so will you, because we're going to talk about a lot of different ideas and strategies here. Now, when do we start talking? It's my opinion that there's no right age. And no one is too young and no one is too old. We just need to use child-friendly language, of course, when we're talking to children. If we're talking to adolescents or adults, family members, then we're going to use language that's appropriate for them. And this includes that if we have an individual with limited receptive or expressive abilities, we're going to use what form of communication works for them. Okay, so we want to talk just openly and casually about autism from the time that we're able to do so with composure, right? So even though individuals with autism may have some difficulty reading nonverbal communication or the behavior of others at times, not everyone's the same. And as we know, some people on the spectrum can be highly sensitive to the emotions of other people. So if there's a parent, family member, adult in this person's life who's very upset while they're discussing autism, the child or the individual is going to pick that up and think that this is something to be worried about, scared of, that it's bad, right? And it's okay. The child, even the adult that you're talking to may not be able to get it the first time. You guys, I'm a psychologist, and I didn't learn everything I needed to learn about autism the first time either. In fact, I'm still learning. So either, that speaks to my intelligence, but no, it really speaks to the fact that there's so much to learn and know. And in fact, who here isn't still learning about themselves and their family members, right? So this isn't something that's unique to people with autism. We're always in that process of self-discovery. Okay. All right. And a little funny vignette from my own house. One of my sons has ADHD, and I had this book on the coffee table for months, brought it out and said, hey, honey, this book about ADHD, or this is the medication you take, this is, why you have some support at school. And I thought you might like to see this book that talks about some different people with ADHD. And it's cute. It's called All Dogs Have ADHD. And he would look at the pictures in that book, and he knew he had ADHD. He knew those words went with him, but it was probably 9 months later when he put the book down and he turned and he said, Mom, I think I have this ADHD. And we went, oh. So it just, sometimes it takes some time to kind of sink in and self-identify. And we want that to be in a positive, healthy way. The same way that, I self-identify as a person who wears glasses, or someone else in the audience may self-identify as someone who is diabetic, right? Okay, so I get this question a lot, do we use the A word? What do we say? Should we just call it like developmental difference or challenges, and I'm a big fan of using the word autism. Avoiding that word sends the unintended message that autism is something to be, it's an unspeakable. And I don't feel that way. I've met a lot of great people with autism, and I don't think it's a problem to talk about autism openly with our loved ones. So we certainly don't want to unintentionally send the message that it's bad. Or I've even had more than one family, more than one adult on the spectrum say, well, gosh, when I first learned, the people who told me were so upset, I thought I was going to die of whatever autism was. So just keep those things in mind. And I want you to discuss autism just matter-of-factly, with calmness and composure, the same way you would discuss other differences or uniquenesses, the same way that you would talk about parents being divorced, or someone having depression, or someone wearing glasses, someone being adopted or having diabetes. Okay. All right, so when we speak to our loved ones in this manner, it's really anxiety reducing. We're also sending the message that you don't need to be ashamed of this. It's also going to help increase their comprehension, because one of the things that we know about stress in the brain is that if we send someone into a state of anxiety or increase their stress, their comprehension and learning actually decreases. So it's best to keep that in mind and make sure that everybody is in a learning state of mind. I always recommend to parents to try not to create a situation where they have to break the news. Okay. Breaking the news is generally something that we do for big life-changing things or bad news. It's not usually the way that we talk about glasses or just pieces of background information about others. Now, I'll let you in on another insight from my personal life. I had been giving this talk, for several years. And as an adoptive parent, then wound up with a child in my home who was diagnosed with autism as an adolescent. And we didn't have the opportunity to talk with him about openly about autism, during his upbringing, because one, we didn't have him then, and two, nobody knew he had it then. So even though we talk about try not to have to break the news, I, the speaker of this information, found myself in a situation where I did have to break the news, where we had to have that initial conversation. And it was hard. It was tough to find the right time. And I had all of those thoughts and worries. What if I don't say it right? What if he doesn't understand or takes the wrong information? What if it hurts his self-esteem instead of helps? So I've been there, right? And there's no judgment if there is a situation where you now have to break the news, or you think, oh my gosh, we didn't tell him, we've failed him for 15 years. Just no, I don't believe that. I think every family and every individual does as well as they can with the information they have at the time. So your situation may have been one where you're right. It really was best not to say anything until later or until now. So don't judge yourselves, don't beat yourselves up. We're all here learning and growing. And, even when we think and we're going to plan and have things go just so, life can throw us a curveball and we end up in a different place than we thought. So in parenthood, Max's parents visit a doctor who gives them some ideas and he says, oh, so you told him, how did it go? And they kind of said, well, we told him it was a disorder. And the doctor's going, oh, you did what? So they sort of realized that they missed the boat, and that hurt their self-esteem too. And that's the part where I think even this professional could have done a better job of saying, like, don't judge yourselves. You tried, you did the best with what you had at the time. Now let's give you some suggestions to make it easier. And what this TV doctor did was give Max's parents a little script, some things that they could say or some activities they could do, some books and resources so that they could talk to him. Now, the big letdown of the whole show was that he didn't share that with us. No, just kidding. But being able to work with families and individuals over the years, I do have some scripts and ideas that I'm going to share with you tonight. So hang on for those. All right, when Max's parents get the information, they go home and they do a much better job. They have a time kind of between activities. They have a coordinated approach. They've both decided what autism is and how they're going to talk about it to Max. And they're not stuck on him learning all the information right at one time. They do bring up how he might be, they say wired differently. And Max says, that's silly. I don't have wires inside of me. But they kind of take his lead. This time they have a book written by somebody about his age and suggest that he might enjoy reading it. Max kind of looks at him and says, can I go play now? And they do the right thing by saying, sure. So they don't hold him captive against his will or make him learn more than he wants to. They started with just little bits of information and they've opened that door for continued conversation, right? Okay. So here's some tips for talking, all right? And these can also be tips for more picture-based communication as well, but specifically some of these are going to be relevant to language. I suggest that individuals avoid using words that are value-based or judgment-based, okay? So we try not to say, and I'm guilty of this, it's tough, we're all going to slip them out, but we try not to say good or bad, you do things well or poorly, better or worse than others. Instead, I really like the words efficient and inefficient. Now, most people say to me, but my child doesn't know what that means. Perfect. That's exactly what we want. So we want to assign those new words. We want to give them that new vocabulary, that there's nothing inherently bad about something being less efficient. All right, even just think about your cars for a minute. In Texas, some people find it efficient to drive big trucks that can haul things or carry lots of people. And that's the most efficient way to move from place to place. But when commuting to work, it might be more efficient to use the smaller electric vehicle. Okay, it doesn't mean one vehicle is, inherently bad or inherently good. They just are different in terms of their efficiencies for different tasks. If I needed to pull a trailer, that car that's very efficient for taking me to work would not be the same efficient choice, right? So that's kind of how we want to use these words. I also like easier and harder because they relate to effort, not necessarily ability. Okay, so just take a second and think about that. I have to put forth more effort to spell because spelling is harder for me. Now, do I sound like a person who's still going to try spelling? Yes. But did you notice what I said at the beginning? I actually told you I was a bad speller, didn't I? What does that sound like? That's like a person who's kind of given up on spelling. I hate to say it, but that's also me. So just think about your word choices. And it's always okay to retract and backtrack if you realize, you said something that could have been better said a different way. It's fine. Remember, you're not going to have instant comprehension. You're going to have lots of conversations over time. So you have lots of time to get this right and to modify your language. I strongly recommend that families leave out the word disorder until understanding is much better. So for me, it sounds sort of like setting the stage. First we talk about different people in the household or point out different information about different people in the household. Daddy wears glasses. Uncle Bill takes medicine for his heart. Brother takes medicine for diabetes. Sister wears glasses. So we're setting the stage that people are different. We all have things that make us unique. And sometimes our uniquenesses are similar to other people's uniquenesses, and sometimes they're not. So we set that stage. Then over time, we have the ability to say, would you believe that some people actually think autism is a disorder? And then we can process that and talk about that. Would you believe some people think wearing these fashionable glasses means it's because of an eye problem? Okay. So we also want to talk about successful people on the spectrum and meet other people on the spectrum, of all ages. It's important to have peers on the spectrum and of all support needs, right? All levels of support are important. And I think likewise, having role models, adult self-advocates, mentors who are willing to work with younger individuals about what it means to be a successful adult. Okay, so here's one idea for what's worked for some families I've worked with. And this idea, actually, I didn't develop independently, but has come a lot from some psychologists that I worked with in the past who knew many, many families and individuals on the autism spectrum. And so we would say, how you find spelling really easy? Well, that's because when you spell, this part of your brain over here lights up. It's a really efficient part of the brain for spelling. When I try to spell things, this part of my brain over here lights up. It's not the most efficient for spelling. It doesn't mean I can't spell, but I might have to practice it and work a little harder at it than you do. But for, making friends or for Doing our work in the classroom, we're the opposite. I find making friends pretty easy. When I go to make friends, this part of my brain lights up over here. It's efficient for making friends. You use this part over here. It's less efficient, so that's why you sometimes find making friends more challenging. It does not mean you can't make friends. Just that you might have to work and practice at it. That's why you practice with Miss Sally at speech, or fill in the blanks. So again, this isn't intended to be a word for word. You don't need to read it off of a paper. You'll have to think about your child and what makes sense for them. So this is just one suggestion. And again, this suggestion is going to be for a developmental age where they're not going to say, that's not the part of the brain that does that. My neuroimaging book says, so that individual would obviously need a different approach. Likewise, this is a pretty verbal approach. So if we have a young person, an adolescent or an adult who is not as comfortable with the verbal conversation or has trouble interpreting verbal communication, we're going to need to use a different approach. All right. So another idea is to use a picture-based approach. All right. Now, when we're talking about differences and uniqueness on a brain-based level, sometimes there's some what we call metacognitive skills that come into play. So being able to think about our own thinking and that other people think and feel differently than we do. And if we have an individual that has higher support needs and is going to have a harder time with those concepts, then I just keep it more basic. Just in the same way that families come in all different shapes and sizes, bodies come in all different shapes and sizes, brains come in all different shapes and sizes. And did you know the art portion of your brain? Wow. So it could be very visual, right? Whatever is going to work for that individual, what's going to resonate with them, that you can go back to. And this may be a trial and error process. You may try something like Max's parents started with well, you're wired differently. And he said, as a very literal and scientifically oriented kiddo, he said, wires? I don't have wires inside of me. I have blood and vessels and muscles and connective tissue. So his parents knew pretty quickly they had to abandon that approach, and that's okay. So parenting, even interactions with others, it's like sailing. We're headed in this general direction, but sometimes we get off course and we have to correct, and then we correct again, and then we correct again. So we're learning from the feedback in our interaction with this individual. All right. So here we have, the world has all different brains. And sometimes there are more of one kind of brain. Right? And when we have these groups of brains, we give them names. Okay, so we can keep it simple. All right. And I have also come across one of the resources in the resource list, the book Autism, What Does It Mean to Me? And I think this is a really, really great resource published by Future Horizons. It's a workbook style book. And I think they generally recommend the book for about 4th through 8th grade. I think the recent edition, they've kind of expanded the upper limit. But I'll tell you, I have been able to work with adolescents and even adults on the autism spectrum. The book is just such a wealth of knowledge, and it's a tool to be used communicatively by the individual on the spectrum and his or her support team, so they can share what they want to share. They can keep pages that they want to keep private. And I've had really good success that if I have a good working relationship, even with an adult client who is new to the idea of autism, that we've been able to use that tool effectively. And that book, I won't take credit for this idea either, that book has a really neat way of talking about autism for older readers, and there's a special section, and it describes brains as like an operating system. So the same way a computer has an operating system, so do our brains. And some people have, a Windows operating system on their computer, and some people have an Apple operating system on their computer. Some people have an Android operating system on their computer. So similarly to different operating systems on computers, brains can have different operating systems. One type of operating system on a brain is the autism operating system, right? And another type of operating system on brains is the plain operating system. And I like that because the abbreviation is a POS, for a plain operating system. So it's a very strengths-based approach and a good guide for self-discovery. So that's another recommended tool that I think can be used, with dignity and respect across quite an age range. I like the way that the book is set up because as you go through learning about autism, it doesn't assume that every person with autism has the same way of being or the same presentation. It'll talk about, sensory sensitivities, and then it'll allow the reader to say, I will circle what's true for me. So they get to think and self-identify with what makes sense for them. And it might be, none of these. It might be, I need to fill in the blank for my own idea, or this is just something that doesn't apply to me. So it leaves it very open-ended. And I think that's a neat way to do it. Let's see. So another thing that I've actually done is worked with a group of young adults, 25 to 30, on the autism spectrum. And we together decided to process, what does it mean to have autism? So one of the things that we did in this group was pull out the DSM, and it was the DSM-4 at the time. And we went through the diagnostic criteria. These were people who'd already known about autism. And we started with, did you know that some people say autism is a disorder, and that's why it's in this book, and let's look at the criteria. So it was great because as we went down and looked through the criteria, they were able to see that some things applied to some people and some things didn't. And my favorite part was when, talking about social relationships, and the individuals in this group said, trouble with social relationships, like, look at us, we have a group, we have friends, we have great support from our family. Some of them were employed, some were in school, but it was a nice empowering activity for this group to get together and be able to see, what resonated for them and what didn't. All right, okay, so now one of the things that a lot of families run into is, well, what do I do if, he or she says this? So I ask, when I give this presentation or other presentations, I'll say, please, please, please hold your what ifs until the end, because one, we might address it. And two, what ifs are just that. When a child or a coworker or a partner comes to us with a bunch of what ifs that aren't our own, we can often recognize them as just what they are, worries and anxieties. It's easier to dismiss other people's what ifs than our own. So I'll tell you that most of the what ifs you might be thinking tend to not come true. And I know this because when I work with families, we make a what if list, right, to try to address them in advance. Then a neat trick is to go back after we've started these conversations and look at our what if list. Look at the worries and concerns that we had as adults before this process started and kind of see what did and didn't happen. Did things go better than we expected? Did all of those worst fears come true? If they did, that's okay because we had a plan, right? That's why we did this exercise. But I'll tell you, 99% of the times, the what ifs were way bigger and more concerning than what actually happened. But some common things that people do run into, I have different categories that I fit these into. One of them is wishing and wondering. So on, just wondering about differences. And this is true way outside of autism. You know, people, I wish I didn't have hair like this. I wish I didn't have to wear glasses. My friends don't. You know, why can't this go away? Why can't autism go away? I wish I didn't have autism. Why me? Now, a lot of families report that they run into these concerns on hard days. So maybe their young person had a hard day at school or at work. There was teasing, they weren't accepted. And it's important for us as caregivers, as friends, as family members, as, you know, even others in the community, as neighbors, to remember that if we just tell someone they're wrong, they're going to hear, you know, you're wrong, you're not, your idea is not valid, you should think and feel something else. And let me tell you what happens with that information. It bounces right off. It does not sink in and make a lasting impression. So it's important that when someone comes to us with a concern like this, that we join with them, all right? And then we offer them some additional information. So if someone's coming to you saying, you know, I wish I didn't have autism, or I wish things weren't so hard for me, and you say, oh, things aren't hard, you'll be fine. You know, take it outside of autism for a minute. And if somebody came to you with their perceived problem, you know, why me? Why did I have to lose my job? Oh, you didn't lose your job. They're going to hire you back in no time. They're just going to recognize how great you are. I mean, we would never say something like that in other facets of life. So we want to remind ourselves how to be good, empathetic listeners and responders, that when someone's coming to us with a genuine concern, we meet them genuinely where they are. You know, so look at what is it that they're really saying. You know, I wish I didn't have autism. You know, I wish going to school was easier for you too. I'm so proud of you for doing it every day. So we want to kind of get on their level, hear what they're saying to you. You know, autism is just one thing about you. All the things about you are what make you special, right? Or, you know, even why me, or why can't autism go away? Oh, but you are so good at drawing or math. You know, maybe without autism, that wouldn't be true, right? Because like many things, autism helps brains be more efficient in some areas. You know, and we know this about a variety of labels that we give to brains. So ADHD can come with a lot of creativity and problem-solving abilities. You know, same thing with dyslexia, some learning disorders. So just because we call something a disorder doesn't mean that it doesn't have any strengths or positive sides too. We just work within the medical model, and for people to get intervention or services, it has to be called a disorder. But we can work with, there's so many other models out there, and neurodiversity and uniqueness and things that are, you know, growing now in popularity. And those are the ways that we can talk to individuals we care about. So sometimes it may be hard if only one person in a household has autism, or in a classroom, or in a workplace. And there may be times when this person feels alone, or like no one gets them. And just stop for a second. This is typical behavior. These are normal feelings under those circumstances, right? Each of us can probably point to times we've felt alone, or not felt understood, or felt isolated. So we want to make sure that we're responding in that empathetic way and that genuine way. So if you hear someone, or your child, or your coworker, or your spouse say, you just don't get it, you know, you don't have autism, you don't know what it's like. I don't even purport to know what it's like. I don't have autism. I don't know what that experience is like. So I say, yeah, you're right. You know, can you help me understand? It's also okay to say, you know, you're right. I don't get how hard it is at recess. But my experience is, you know, the teachers are there to help, or the teachers want to help you. Or my experience is some of the kids there are nice, you know, and that there are friends to be found. You're right. I don't get it, but I would really like to try. You know, are you willing to help me with that? Okay. So we'll talk about any questions that you might have in talking with, children or adolescents. But another area that we want to just touch on briefly today is talking to family members about autism. So this would include extended family or siblings. And a couple of tips that have come up as helpful for families I've worked with over the years. One is, to avoid statements that blame autism for behavior and to use words that people understand. So a lot of times when we're explaining or talking about autism to adult family members, they may not have a lot of information about autism. Kind of your typical example is, well, I saw Rain Man, but we all know not every person on the autism spectrum is like that. So we don't want to use terms like autism right off the bat that they may not understand or blame the behavior. So for example, do not say things like, oh, John's autism is making him upset. Do say things like, oh, John's upset because it's too loud for him. Or John's worried we might not finish the movie. So you take the behavior that you see and discuss it in a way that anyone can understand, regardless of their knowledge of autism. And that's going to help family members and others, be able to feel like they can relate. Oh, well, now I know what to do. Oh, well, now I know how to help. Okay. So I also really advise people to talk in terms of the child or individual and not use, we language. While we want to be empathetic and join with them, we do not really want to use we language. And this goes for educators too. I read in some preschool reports, like, we're working on potty training, or things like that, in IEPs. And that's not true. This student is working on toilet training. Probably the staff has already mastered that skill. Typically we master skills and then we teach them. So you might say things like, oh, John's working on tolerating the happy birthday song. He and I are going to step out for that. Not like, well, we're still working on tolerating the happy birthday song. When you join too closely like that, it's hard for people to ask questions and know how to help, because they can't separate, who do I ask the questions to? How are we going to do this? And it becomes harder to talk to. I also recommend that people use schedules and stick to a schedule, just like we can do with children or students, and blame the schedule for what's coming next. Like, oh, I know you really want to eat dessert, but the schedule says first we get pajamas on and brush our teeth, or that wouldn't make sense. First we get a bath and brush our teeth and pajamas on, then we could have dessert. So again, using the schedule for your exit plan. So you could say like, oh, it's time, sorry, we've got to head out. The schedule says we have somewhere else to be if you have to exit a gathering. Okay. So in talking to other children, there's a few things that have come up over time. Explain any self-stimulatory behavior, atypical behavior, or unexpected behaviors that might occur. So we want to give, again, remember we talked at the beginning about external and internal reasons? The same is kind of true here. So if children see something and they don't understand it, they don't know how to conceptualize it in their head. And oftentimes as humans, we can be scared of things we don't understand. But if we say, oh, John is really happy, and if that's what it means when he does his hands like that, John, are you feeling happy? Then the other classmates or other kids, other family members go, oh, right. And then they understand. They have a reason, they've got an explanation, and they can then engage with that person with that behavior. Explanation, education is key. So I think it's also important to explain that autism is not contagious. This is something especially important right now, given the worldwide pandemic we're all experiencing. You may even need to say, autism is not a virus. So right now, sometimes children are really good at learning about airborne disease and contagions and viruses, and have over-attributed this sort of a cause to other things in their environment. Now, is this because they're mean or malicious or, trying to say autism is a disease? No, it just reflects a lack of education and a lack of knowledge. So we have this choice and this ability to help educate them, right? I also like to use what I call can'ts and won'ts. And I think this is really important, especially in managing sometimes sibling relationships. I even encourage parents to use this language to help get on the same page with each other. So, there may be times that for all of us, we are capable of more stress, of more doing, of more production than other times. Sometimes we've just had enough. And that may look like, most of the time I require my child to clear the plate from the table. But today they've had a really rough day. We're just kind of teetering on the edge of emotional control, and you can tell that a meltdown is imminent. And somebody says, well, Billy didn't take his plate to the sink. I can stop and say, you're right. Tonight Billy didn't take his plate to the sink. That's a can't, not a won't. So we're going to let it go. And what we're saying is, tonight that is beyond capacity. It's not a judgment call. It's not because he's, worse or isn't trying. Tonight he can't. And I think we've all, you can see the memes, we've all had those moments where we say, one more thing, I just can't. But a won't is different. So let's say I approach a family member and there's a child having a tantrum on the ground, which is different than a meltdown. And, give him some space. Sometimes he just needs some space and some quiet. And I can say, this is a won't, not a can't. This is just typical behavior of not wanting to do something. So I'm going to kind of stick this one out. So can'ts and won'ts can kind of give a different way of talking about it. I also have a lot of adolescents and even adults who will use this language with others in their household and say, like, look, this is not a won't, this is a can't. I have to call it a night. So it can just be something to help put people on the same page. And always invite children to ask questions. That's so important. If we have questions and we're lacking knowledge or information, again, that's where imaginations can run wild. That's where we can feel uncertain and attribute other reasons for things. So we want to hear what children are wondering and thinking. All right. Let's see. And to kind of get to our summary, but tips for talking to strangers. We'll talk about that briefly first. So strangers, and this comes up sometimes for a variety of people and families. If something is happening in a public setting that seems unexpected or out of place, so maybe a meltdown in a restaurant. It could look like a shutdown in the workplace. And there's a decision point here. If parents report to me, they feel very uncomfortable, like if their child has a meltdown or a behavior problem or gets overwhelmed or overstimulated in public and people start staring. And I tell them, you have a decision. You can ignore them or you can educate them. And it's totally your choice. And then I also encourage them and say, this is something I actually learned in an adoption support group, but to ask them, why do you ask? Or can I help you? Or, I noticed that you're observing closely. So get in there and find out what is their intent, and you'll be surprised. Most often when we hear something or we see something that could be attributed as being offensive, we have a tendency to kind of go that direction. So for example, if someone says, is that your real child? When you're out with an adopted child, that's offensive. But it also is sometimes just an uneducated way of bringing up a conversation about adoption. So in this support group, I learned to say, well, why do you ask? And the family may say, oh my gosh, because we've been looking for an agency, we've been trying to adopt. Do you recommend your agency if your child's adopted? Or we're waiting and can't wait? any longer. We're so excited. So they may not mean any harm or disrespect. And then we have a chance, oh, okay, so yeah, here's the agency, and just so here's how you might say that next time, or here's what we say in our house. All right, so you can check it out. Why do you ask? And I've actually had families be approached because another family thought they might have a child with autism, or they have similar behaviors. And this other family is literally the first or the next family they've seen that had a child on the autism spectrum. And so they'll say, is your child, does he have autism? And if you say, back off, or respond in an ugly way, we might miss an opportunity to help, another human being. So check it out. I also had a family teach me that one way to do this was to make business cards. This family had a particularly difficult time in stores, and it was something that they wanted to work on slowly in a manageable way so that their child could have more enjoyable outings. But sometimes they'd overdo it or not know, or there would be a loud noise and he'd get overstimulated and have difficulty regulating his emotions and his behavior. So this mom really didn't like being stared at and didn't like the idea that people might be judging her. So she passed out business cards that said, my child has autism. Thank you for your concern. You can learn more at. And then she provided an educational resource for them to learn a little more about autism. I've seen other people do this with, here's what you can do to help. Here's how you can help me. So different things, different ways to do this. But most importantly, just understand it's not your job to make anyone understand, and they may not understand. All right, so resources. I will have a resource list that will be posted that we'll talk to you about and put up with the video and with the PowerPoint that may be helpful to some of your families or some of you. And now we're going to turn it over to questions.
Great. All right. Hi, Dr. Montfort. Thank you. This is
Hi
Jackie from Autism Society of Texas. And then right now we are going to look, we've had a few questions. I know some of you posted questions in the Google Doc we posted. If you have any more questions, keep posting them there because I'm reading off there. So first of all, Dr. Montfort, we have a question about kind of a new diagnosis for an 8 and 12-year-old. So kind of, this is two different kids, but similar issues, trying to explain, like if they have to explain like what's wrong with the child, which, that's what, they don't want them to think that, of course, but they don't want to have them miss their regular activities and after school fun things like karate or soccer or other extracurricular activities, or be pulled out for therapy because of those things. Don't want to make the kids feel self-conscious, like especially for the 12-year-old, making sure they don't feel ashamed. How would you, and especially in explaining why you're getting tested, like at age 12 or so. So if you have advice for that, that was
okay. Well, good questions.
It's similar, yeah.
Yeah, I love it. So we'll jump right in and talk about the testing first, and then talk about the therapy. In my world, that's kind of the order things happen in. And so for testing, one, it's really important to find a provider who is going to be able to do what I call like a therapeutic testing. So this means taking those questions as they arise. The only thing I love more than assessment is talking about assessment and self-discovery. So I always invite the young people that I work with, of course the adults also, but often children will need a real direct invitation. If you ever have a question about why we're doing something or what this can teach us, let me know. Testing can't read your mind or find things that aren't there. It's just to help us understand how different people think and learn. We all think and learn in different ways. And these tools are going to help us tell, what those ways are for you. We might learn how you study best. We might learn why some things are easier or harder for you. And we might learn how to make certain areas more efficient. Okay. So I think that's a really important way to talk about it. I don't really like to say, you're going to go play some puzzles and games with someone new or someone nice, because it's really not what's going on. That is one explanation that can be used, but there is some research to suggest that then individuals don't take the testing as seriously, and we want them to put forth their best effort. So as far as interventions and why, someone might go to therapy or what's wrong with them. So I would first cut that word wrong, right? Because we know that now that that's not the most helpful way of discussing it. But you're right to think that the young person might think, what's wrong with me that I have to miss, baseball or soccer to go to therapy? So we do want to intervene when that's a risk factor of them thinking that. So I tell people when they say, what's therapy? I say therapy is practice. And really it's true for all kinds of therapy, whether it's physical rehab, speech therapy, even psychotherapy. That's practice with your emotions and practice with relationships, counseling, parent training. So I think you can conceptualize a lot of different therapies as practice. So we, just like you go to soccer practice, we need to find some time to practice some other things. Okay, so we're going to still keep you in soccer practice, but on these other days, we're going to go to practice where you're going to learn how to, have conversations easily, or you're going to learn how to, read, or you're going to learn how to interact with kids your age, make friends easier. So whatever it is that really conceptualizes your young person's need for being there, let's go ahead and name it, right? Because they're going to. And I think, that we all agree, on this Zoom tonight, that keeping your children in their regular activities, so their soccer, their karate, those sorts of things that they're already doing, is equally important to therapy. It's great interactive time, even if they're not socially interacting with everyone there, they're around the interaction, they're developing language, they're being part of a group, which is so important to our feeling connected, is being part of a group and accepted. So if things are going well in those other activities, we would just encourage you to schedule therapies around that. If we're talking about something that's like every day or more hour intensive, like ABA, you really need to find a therapist that works for your child and family and accommodates and realizes the importance of those other activities.
Great. All right. Thanks, Dr. Montfort. Our next question, it says, I didn't get an age, but this probably goes for, I would say, most kids. It says, how do you suggest we approach when professionals use the words such as disorder, disability, and such? And I know at the beginning you said avoid the word disorder, but obviously they're going to learn that and learn the phrase disability. But what do you do when they're kids specifically about that, when professionals are using?
Good question. And I would encourage, like we said at the beginning, all of you know yourselves, your family, your children, your loved ones best. And that's always true, no matter what professional you're sitting in front of. I may know a lot of things about autism, but I don't know a lot of things about Billy or things about Billy and autism. And I need families, parents, and individuals to teach me about that. So one of the things that I'll often do when I start meeting with a family or an individual is I'll say, before we meet, what does he or she know? What are you comfortable with them knowing? What are you not comfortable with them knowing? So we want to put those things out there from the beginning so that I can respect the family's wishes and work within, the guidelines that the family has set. For adults or, individuals on the autism spectrum who are older, who are aware of their diagnosis, I ask and learn from them, what do they call it? Different people self-identify in different ways. And I don't need to force them into my way, so I'll use their language. And I think that's important. I also invite parents for a time to speak openly when they're not in front of their child. So I'll say, we're all going to meet in the beginning, we're all going to meet here together and talk about a few things. Then mom and dad or, the adults may want to say some things to me without you present. And you may also want to say some things to me, without the adults present. So we'll make time for that. And then I make sure and let the adults know, if we're going to talk about anything that is sensitive or that might be interpreted, in a way that could be harmful, please save that until it's just us. Right now I want to get to know you guys as a group. So if you have a provider who hasn't kind of provided that framework or those guidelines, as a self-advocate, as a caregiver or family member, don't be afraid to step up and put that information out there to say, you know, before we meet, I need to let you know he or she is not aware of the diagnosis. They don't know the word autism. We don't use it in front of them. And this isn't how we want them to find out. You know, so put that out there. I think any provider or professional will definitely respect that.
Great, thank you. All right, our next question, a parent said, sharing the diagnosis with her son and her family went very well. But however, respecting her son's privacy, it's hard to know when to share with friends and strangers.
Yes, it is. And I'll tell you, it doesn't get easier. So I told you the children that live in my house, and really the individuals that live in my house have differing labels, shall I say. And as people get older, it is their choice. It's their story and who they want to tell. And even really when they're younger, to the degree that they can help participate in that process. Sometimes for safety reasons, we need to let others know. And if you have even a young person who's like, Mom, don't tell the school or don't tell my friends, if there's a safety reason, then we just need to explain that. You know, if you had an allergy to bees, I would tell about your allergy to bees. So for example, one thing that comes to mind is elopement and wandering. This can be an issue in autism spectrum disorder. So if you have a loved one who is prone to wandering or elopement, particularly when, when it's under stress, maybe they seem like they would not do that, but under stress they might. That's going to be some information on some level that needs to be disclosed. Now, do we have to say the whole diagnosis? Maybe not. So it's a conversation you could have, but I do try to respect the rights and dignity of the individual and their comfort level. And a lot of times we'll hear this about, do I disclose to an employer, to someone I want to date, to my partner's family members? And so it can be helpful to have a therapist or someone on your team to kind of talk about that with. And I used to be just kind of a big advocate and think it's always better to share. But as I know more people and as I have walked more journeys with more people, I see that there can be some consequences. And especially the intersection of autism and different cultures, there can also be consequences. So, sometimes we'll say, use different wording, like we want the school to follow these recommendations, but it would be detrimental to report that the child has autism, so we conceptualize it a little differently, still within the bounds of the truth, of course, but in a way that respects that family's wishes.
Great, thanks. And then we had, this is pretty much, I think, our last question, but and it was kind of more a comment, but it was asking about, talking about, we have this a lot at Autism Society, person with autism versus autistic, and we use both. But depending on, a lot of times if we're working with the adult community, we'll say the autistic adult community or the autistic whatever, we have programs for autistic adults, whereas a lot of parents are used to saying person with autism. When you're working with a child, is it good to introduce that, like both of those languages, just use what the person's preference is? That's what we also do. Sometimes we've had autistic adults that didn't like the word autistic. So we tend to, at Autism Society, use both and go back and forth. But they like, particularly when working with children, what do you have a suggestion for parents about that?
I think it's a good question. And I think it's important to talk about it because it does seem to vary. And like you all at the Autism Society, I do go back and forth. And I also respect the preferences of the individual. So as, what resonates for you? And we used to have even kind of more terminology with, PDD-NOS and Asperger's being in the mix. And I still have found some self-advocates who prefer to say Asperger's or ASPE instead of autism. And, while I'll do one thing in a diagnostic evaluation or in my chart notes, it doesn't hurt me to respect that person's wishes. So I'm happy to do that if that's how they self-identify. When it comes to children, I do think hearing it both ways might be helpful so that it's something that they're familiar with, and maybe even having the discussion. Did you know that some people think there's a right way to even talk about it? And it's important. And I always show them or talk to people and say, in the literature, it might be a person with autism, so people first language, and they're non-disabled or typically developing peer. And it's backwards, it's people second language. So even the people first language isn't very consistent in being people first. So I think it's one of those things that, if we tiptoe around it, it gets funny, and then we're not sure what to say, and then we stop saying it because we don't want to say it. And before you know it, we have a situation where we don't use the A word, and we've created all of those things we're afraid of creating. So my opinion is to approach it head on, use it, talk to the individual. And this is a great way that we can promote kind of understanding, acceptance, reduce stigma, is by continuing to have these conversations.
Great, thanks. That's really helpful. Good. All right. Well, that is all the questions we have. I was just going to say a couple of things that I meant to say at the start, but I want to remind people that we have Texas Autism Advocacy Day next Thursday night, April 8th. It's free. The event is on Facebook, so you do need to register. We'll be having a day of action and having multiple action alerts and things you can do for different areas, autism therapy. We've got special education, telehealth, broadband, ECI funding. So we're working on multiple issues right now. That event's free, but you do need to sign up on Facebook to get the Zoom link. It's on Zoom. It's not going to be on Facebook. And then our next event for seminars across the spectrum is May 13th, and it's reducing racial and ethnic disparities for children on the spectrum with Dr. Sandy Magana from University of Texas. So we hope you guys will all join us for that. We're also, as Dr. Montfort said, we're going to have a resource list with the books and different references she's mentioned, and we'll post that with the video in this video link on Facebook. We'll go ahead and post a resource list. And if anybody wants it emailed to them, you can also fill out the Google form and give us your email address, and we'll contact you. The other thing I was going to say, we do free information and referrals. So we work with families and children. We also support autistic adults. So if it's a new diagnosis, you're looking for a therapist, anything, employment, whatever the issue is, all things autism related, we help everyone across the lifespan. If you posted a comment in our Q&A and it was a personal question that you need to find a therapist or something else, we will respond if we've got your email, which I think almost everyone left their emails. So we're not going to have those questions answered now, but we will get back to you. And I think that's about it. We have online support groups. We have all kinds of things. So if you need referrals, support, anything like that, please feel free to contact us. Dr. Montfort, thank you so much for your time. This is a really, really good topic and really great to kick off Autism Acceptance Month with this. So we're really glad to have you. Oh, you're on mute.
Thanks so much for having me. And it's a good topic, and good luck with a great month of your autism acceptance.
Thank you very much. All right. Thanks, everybody. I'm going to stop the live stream now, and thanks for joining us.